So muscle dysmorphia is a subtype of body dysmorphic disorder in which the area of preoccupation is one's level of muscularity or body size. Typically affects males, although women can also have muscle dysmorphia. So these are individuals who actually could be quite muscular, quite fit, and see themselves as looking too small or too weak. So treatment would actually look at targeting the obsessive thinking around the body. So these are individuals who are always thinking that they look too small. And then that's coupled with a lot of behaviors, either compulsions like mirror checking, compulsive weightlifting, comparisons to other people, or certain avoidant behaviors. Like these are individuals that won't wear short sleeve shirts in the summertime, won't take their shirts off at the beach, may not even be seen in certain places because they fear that people will perceive them as too weak. So treatment would be similar to what you would see with BDD that really targets those avoidant behaviors and compulsive behaviors. So with a typical muscle dysmorphic patient, I might first start at looking at their compulsive exercise or weightlifting. So again, these are patients who might work out 4 to 5 hours a day, and we try to get them down to a normal, sort of healthy amount, because there's nothing wrong with working out as long as you're doing it in a healthy fashion. We would expose them to social situations that they typically would either avoid because of the fear of being seen, or they might not go to because they're at the gym spending too much time on their compulsive behaviors, that they might miss very important social events. Part of the treatment, seeing that about 50% of my patients with muscle dysmorphia engage in the use of anabolic steroid use. We really look at ceasing anabolic steroid use, which is very difficult. A lot of these patients find it very difficult to not use steroids anymore because it's a guarantee that their body is going to decrease in muscularity. So we would really work at all of those things and then also address what the underlying theme is. What is it that draws them to be so preoccupied in terms of what their level of muscularity means to them, and what are the themes around having a bigger muscular body. So themes that we would typically see, these are typically patients that struggle with low self-esteem, struggle with social anxiety, some have a history of trauma, all of which really make having a bigger, more powerful body very salient to them. So a lot of these men, again, I treat mainly men with muscle dysmorphia, a lot of these men would say, I need to look big to compensate for how small I feel on the inside. I don't want anyone to think that I'm weak. I don't want someone to mess with me. People who maybe have a history of trauma or a history of being bullied feel that building a bigger body really conveys a sense of power, a sense of threat to other people. So the meaning behind the muscle is something that we have to address as well. And then that means we're also working with trying assertiveness skills and trying to decrease the social anxiety, trying to build confidence, all of which really help these individuals in not relying so much on their external physicality to compensate for what they feel they lack on the inside.